Hello dear students, welcome back to the ECG series again. Today in this video we are going to calculate the heart rate in an ECG. So this video is all about the heart rate calculation. In the previous video we have seen what are the various different steps of analyzing an ECG, and out of them calculation of heart rate is an important one. So in this video I will tell you how to calculate the heart rate using a simple ECG strip. So coming to the topic, we have already seen this graph in the ECG paper setting, that is on the y-axis and x-axis. And x-axis, I have already told you, it is the time duration. And time duration, it is usually measured in milliseconds or seconds. And this time duration is dependent on the paper setting which we do, that is 25 millimeter per second. Why is this important? Is only if I know what is the paper speed, then only I can calculate the heart rate in that given paper. So standard setting is 25 millimeter per second, and all of us know the heart rate is calculated for a minute and not for seconds. So suppose for example, if you are measuring the pulse, you will interpret that it is 72 beats per minute. In a similar way, heart rate also we will be establishing it per minute. So first I should know what is the paper speed or how much the paper has traveled in 1 minute. So 25 millimeter, it is traveling in 1 second. So this mathematics is very simple. 25 into 60, because we are converting into a minute. So totally the paper would have traveled 1500 millimeter per minute. Why are we converting this? Because heart rate is calculated per minute. So now one thing I know is, one simple thing is, the paper whichever we are sending, it has traveled 1500 mm per minute. And what is RR interval? So RR interval, all of us know it is 1 heartbeat. So if I know 1 heartbeat duration and the paper speed, can I interpret like how many times this heartbeat has traveled in that particular paper? Because I know the total distance and I know 1 heartbeat. So indirectly I can say that how many times this has traveled, and how many times the RR interval has traveled is nothing but the heart rate. Can we take any other interval like a PV interval? Yes, obviously. Whenever you take one particular point and go to the similar point in an ECG, that is nothing but 1 heartbeat. But why do we take RR interval most of the times? Is because RR interval is a predominant wave which is easily lookable or deductible in an ECG. So that is why we pick the RR interval. So now what we have to do, I have to calculate what is the duration of this heartbeat. And all of us know that one box is nothing but 1 mm. So I will be counting the number of boxes between RR interval. That will give me the distance between the RR interval or the duration of one RR interval. So it is 1, 2, 3, 4, 5, 6, 7, 8. Then plus 5, it is 13. Plus 5, it is 18, 19, 20. Around 21. Let's assume for our example, it is around 20. 21 is coming. For easier calculation, let's assume it is 20. So 20 is the number of distance for one RR interval. So how many RR intervals would have traveled in this 1500 mm? That is nothing but 1500 by number of small boxes between RR interval. So many of you would have known this formula, but what is the logic behind this formula is, this is the paper speed and this is the distance between one heartbeat. So now heartbeat is RR interval. So that is, in our example, it is 1500 divided by number of small boxes was around 20. That is nothing but it is going to give us 75 beats per minute. So it's very simple, just 1500 divided by the number of small boxes in between two RR intervals. Can we do it much faster? Yes, we can do it much faster with the help of larger boxes. So instead of taking the smaller boxes, we can take the large boxes. So in this example, there are 1, 2, 3 and approximately 3 boxes here, 4 here. Totally around 4 large boxes. 3 small boxes are here and 2 here. So I am merging them together. So it is around 4 large boxes. So instead of smaller boxes, I can do this with the larger boxes. And all of us know that 5 small boxes will make one large box. So instead of 1500, what I have to put? I have to put 1500 divided by 5. That is nothing but 300. Why are we dividing it by 5? Because 5 smaller boxes will make one larger boxes. So if I'm converting the number of small boxes into large boxes, instead of 1500, it is going to be 300 large boxes which have moved in that 1 minute duration. So the formula can be RR interval, that is also 1 heartbeat. How many large boxes we have? We had 4 large boxes. According to our example, we had 4 large boxes. So if you want to calculate the heart rate, what we can put 300 upon number of large boxes. Now we are putting large boxes. So is it easier? It's again the same thing, that is 300 divided by 4, that is equal to 75 beats per minute. So whether you do it by small boxes or you want to do it by larger boxes, both are going to give the same value. But if you want to do it rapidly, you can go for this larger boxes. But if you want to calculate it more precisely, or if you are a first year MBBS students, most of the teachers will be expecting you to do this formula, that is 1500 upon 20, because this will give the exact value. Because large boxes, it might be approximation, but smaller boxes are easier to exactly to predict. But the faster method is obviously the large box method. So these are the two methods which we can do it. And sometimes in some cases, like for example a conduction block, what will be the situation is there will be multiple P waves. Conduction block means especially in the third degree heart blocks. Don't worry, I will teach you this third degree heart block also. In this, what happens is the AV node is firing at a different rate, the SA node is firing at a different rate. So the atria is contracting or getting depolarized at a different rate, and the ventricle is getting depolarized at a different rate. So what will happen? There will be large number of P waves in comparison to the QRS complex. So how do you calculate the heart rate in this patient? Because now the P wave is different and the QRS complex is beating in a different rate. So in these people, we will be calculating the atrial beat separately and ventricular beat separately. In a normal individual, both are same, because atria is going to be getting depolarized from the SA node, and the same number of impulses is going to be traveled into the conduction system into the AV node and then the ventricular fibers. But here the atrial rate will be more in comparison to the ventricular rate. So atrial rate we will calculate with PP interval, and the ventricular rate we will calculate with RR interval. But in a normal person, both are going to be same, and the easier way to do it is the calculating from the RR interval. So I'll be showing you an example ECG. So look at this ECG and try to calculate the heart rate and drop your comments in the comment section. So you can look at any of this part and then go for the calculation. So you check at this part and then try to calculate the heart rate using the formulas which I have given above. So drop your answers in the comment section. So this is like a one kind of practice what you can do. So the same ECG we will keep on analyzing, and finally you will be able to read a ECG properly. So the first homework for that is calculating the heart rate of the ECG and drop it in the comment section. I hope it's clear. Thank you for watching the video. If you have any further doubts also, kindly drop it in the comment section. So I'll be happy to make a video on it. Thank you so much. Stay tuned for more such videos.